the standard of care for patients who are cisplatin-ineligible with muscle-invasive bladder cancer, or MIBC, is a clinical trial or to go directly to cystectomy. The standard of care for patients who are cisplatin-eligible is cisplatin-based chemotherapy with or without immunotherapy at this point before proceeding to cystectomy. So the rationale for this study is that for the 40% or 50% of patients who are ineligible to receive these standard of care cisplatin-based chemotherapies in the neoadjuvant preoperative setting, we wanted to find an alternative that we can give to these patients. And we thought about Abemaciclib, which is a CDK4/6 inhibitor. And the scientific rationale for that is actually dependent on a discovery that we have made showing that there's a lot of cyclin D1 amplifications, so high copy number alterations in what's called extrachromosomal DNA. So these are circles of DNA circles that are outside of the chromosomes, and we published that in Nature at the end of last year, where we described a very high prevalence of these cyclin D1 amplification events within extrachromosomal DNA in patients with MIBC. So based on that, we predicted that would activate the pathway, which is CDK4, CDK6, and then RB phosphorylation, E2F release, and cell cycle progression. And Abemaciclib targets these cyclin D1 CDK4/6 complexes and prevents that molecular cascade. So it is important to note that this was a window of opportunity study. What that means is that we gave these patients the drug without trying to delay their definitive treatment, which is cystectomy. So that was only 4 to 8 weeks on Abemaciclib, a minimum of 4 weeks and a maximum of 8 weeks, and most patients ended up getting closer to 4 weeks. So based on the pathologic downstaging of 31% that we've seen and 3 patients who had a complete pathologic response, we think that this warrants further investigation, probably with longer treatment, because in the neoadjuvant setting we give 4 cycles of chemotherapy, which takes several months. So it's a significantly longer duration of therapy compared to what we've done here. So it was quite impressive to see the pathologic downstaging and CRs just with this very short treatment course. Yeah, so we think that serial circulating tumor DNA has a lot of value in this setting and other settings as well. But particularly in this setting, we used it in this particular trial to answer a specific question that always comes up in these neoadjuvant studies, because the patients undergo a transurethral resection of the bladder tumor, and then they get neoadjuvant chemotherapy followed by radical cystectomy. So responses that are seen at the time of the radical cystectomy, the question always arises, are these, what's the contribution of the TURBT compared to the contribution of the neoadjuvant therapy? And in this case, because we were able to measure circulating tumor DNA at the day of enrollment, or on the day of enrollment, before starting Abemaciclib, and then 2 weeks into Abemaciclib, we could actually tell what's the effect of the TURBT, which happens after enrollment, which happens before enrollment in the study, that we're measuring that ctDNA. And we saw that the ctDNA was going up following TURBT, but actually precipitously dropping after starting Abemaciclib. So we were able to tease out the different contributions, and in this case it was mostly because of the Abemaciclib, not because of the TURBT. So that's one use case for serial ctDNA dynamics in that. In terms of cyclin D1 amplification, so we actually did circulating tumor DNA whole exome sequencing. So we sequenced the entire 20,000 genes in the circulating tumor DNA using the CARAS technology. So CARAS whole exome sequencing, and we were able to actually look at ctDNA, including cyclin D1 amplifications as well. So one can now look at the tumor cyclin D1 amplifications, and we saw, confirming our hypothesis, that the patients who had cyclin D1 amplifications were much more likely to respond to Abemaciclib and experience pathologic downstaging compared to the patient who didn't. so we think this window of opportunity platform is a very exciting platform for testing other therapeutics or different sequences. We found that abemaciclib significantly downregulates important DNA repair genes, specifically genes in the homologous recombination pathway, which is involved in repairing double-strand DNA breaks, and specifically two genes, RAT51 and TOPBP1. And we tested the hypothesis in the laboratory as to whether adding abemaciclib sequentially, so following induction of DNA damage by chemotherapy or antibody drug conjugates, including enfortumab, enfortumab vedotin would prevent the cells from repairing that DNA damage that's caused by these drugs, and we see that that's the case. So that we think that that sequence, that's maybe the next step that we want to pursue here, is using DNA damaging agents followed by abemaciclib to try to prevent the cancer cells from repairing DNA damage and enhancing the efficacy of these drugs.